Hello, my name is Kelly Lawton, your nursing career coach. On behalf of the Center for Career Services at GW, we are delighted to have you join us for the MedStar Washington Hospital Center Nursing Information Session with Kim Sinkford. I will let her introduce herself in a moment, but I wanted to let you know what to expect from today's session. We will be recording today's event and recommend that all attendees use headphones for the best sound quality. Kim will spend about 20 minutes providing more detail about MedStar Washington Hospital Center's new grad opportunities and specific tips in making your application stand out. All attendees are intentionally muted, but if you have questions, feel free to add them to the Q&A box, and Kim will make sure to address them towards the end of the presentation. So at this point, I am going to turn it over to Kim.
Good morning, everybody. Can you see me okay? I'm only seeing Catherine right now. Oh, okay, excellent. Okay, so I'm going to tell you a little bit about MedStar Washington Hospital Center, our hospital, our residency program, some of the ins and outs, and hopefully get through most of the questions that graduate nurses seem to have. So you're nearing the end of your nursing school. Congratulations. I know it's been sort of a hectic time for everybody. I'm going to assume that most of you are graduating in December and will be taking your boards shortly thereafter. And so we typically align our big residency program for the end of February. February 22nd will be when the second largest nursing program starts for us. The biggest program starts for us in July, and of course that coincides with the May graduation. So we do have rolling applications. So if you are graduating in December, you are more than welcome to begin putting your application in at this very point in time. Sometimes if you are hoping for a clinical specialty area and you're waiting for a senior practicum and you're not sure where that will be yet, then you may want to hold off on submitting your application, because that certainly will vote in your favor to have that touch point to that area of interest. But otherwise, by all means, put your application into whc.jobs, and you would literally just search RN residency program. You will submit your application along with your resume and a cover letter if you so choose. We do like cover letters, but I would discourage you from being too specific with your cover letter to the area that you are interested in working. So if your cover letter is all about the emergency department, but the emergency department doesn't have any positions available, then if you're interested in another area and your application is forwarded, then that may give a asterisk to the leadership team that you're really only interested in the ED and perhaps not another area. So just sort of a general cover sheet with maybe a little bit about yourself, community projects, things that you've been passionate about within healthcare. I would encourage you to move in that direction. Once your application and resume have been submitted, there are 3 of us as nursing recruiters, and we literally just divvy it up according to your last name and review over the application. And then we will send you a separate email that is an RN query, which allows us to reach out to you specifically indicating that we've reviewed your application, and just to get a sense of what your GPA is and what the top 2 priority or most interested clinical areas are. And then once you respond back to us, we'll then forward your application along to that leadership team for review. And at this point in time, I would say that generally speaking, the majority of our interviews are virtual. It's a virtual platform, obviously, just due to COVID restrictions. On occasion, there are particular nursing directors that do want on-site interviews. One of them is going to be the emergency department, and that's really because they want to make sure that you have a nice sort of touch point to the environment. But again, the recruiter will go through all of that with you, and you'll have a nice kind of touch point to communication back and forth with whom your focused recruiter is, and that's who it will be all the way through the hiring and onboarding process as well. So right now, the hospital center is hiring into all specialties. There are some that are filling up sooner than others, but again, you'd indicate that and we would let you know if it's not available or go to your second choice for sure. We do manage all patient populations with the exception of pediatrics. Pediatrics is it children or MedStar Georgetown, if that's of interest. But we do manage all level 1 trauma cases. So we're hiring into the emergency department, the ICUs, all of our med-surg floors, which include oncology, pulmonology, stroke, ortho, along with our MedStar Heart and Vascular Institute, which covers our CDICU, our CCU, our Advanced Heart Failure IMC, our cardiology, medical cardiology IMC, interventional cardiology, short stay, and sort of the list goes on. And of course, the women's and infant services, L&D, NICU, and postpartum. I do strongly encourage you to consider what your priority areas are. If you do not have a touch point either as a student nurse extern or as a patient care technician or CNA or a senior practicum in that environment, it will be that much more challenging for you to begin working as a new to practice nurse in that area. It doesn't preclude you, but it just makes it that much harder because we do have a lot of sort of very competitive units that people do want to work on. And again, the recruiter will go through all of that with you, so you're sort of very clear, but I just like to preface that a little bit. The hourly rate for all of our new to practice nurses is going to be $30.24. And that does not include shift differentials for the evening shift or for the night shift or for the weekend. And that's across the board. So whether you're working in oncology, critical care, ED, orthopedics, it's going to be the same rate. And you are always eligible for an annual step increase according to your date of hire. So you do progressively increase in your salary for sure as a clinical staff nurse. The residency program specifically is a really nice sort of opportunity to transition from that of a student nurse to a registered professional nurse. It almost feels like you're back in school again to some degree as far as classroom time. There's a huge didactic portion. We have a huge clinical simulation lab. There are focused nurse educators who work alongside of all of the different clinical service areas, as well as a residency program advisor. And so there's just optimal support, which again, most residency programs have all of that, but we've been doing our residency program for, gosh, well over 25 years now. So we've kind of got it down pat a little bit for sure. And it is through AACN and our Vizient program. What you can really expect with the residency program is you will clinically work in the area that you've been hired into 3 days a week, 3 12-hour shifts a week. You're always hired into a day-night with weekend rotating position. You will be with a preceptor during your orientation period of time. But sometimes within that 36 hours a week, you'll be pulled away for classroom time on the day shift. And that's when you're working with your clinical educators and your cohort. So if you're in an ICU cohort, services cohort, or you're in an operating room cohort, there are more focused classes for those areas. Same thing with med-surg and cardiac and so on and so forth. So rest assured, there will very rarely be a time that you'll work 40 hours a week. It always is 36, but occasionally, particularly at the beginning, where they're just trying to make sure they're squeezing in all the educational opportunities for you as well. And the educators work very closely with the unit's nursing leadership team as far as the calendar and the schedule, so everybody's on the same page. The classroom residency didactic program is much heavier during the first several weeks of working here at the hospital center. And then it sort of transitions to you more being focused in the department with your preceptor. But you will always have monthly residency program classes. And they're mandatory. They're absolutely expected that you attend all of them. And that's where you're working towards an evidence-based project that you will present at the end of the year, and you'll be amazed with how much you've learned within that period of time. And that evidence-based project is something that you and folks in your department collectively work together to identify something that could be improved upon here at the hospital center, whether it be safety, quality, patient satisfaction, employee engagement. There have been a number of different evidence-based practice programs, and you'll go through that process with the nurse educators and then present to senior nursing leadership again when you're at the end of that year-long program. Your clinical orientation tends to be about 3 to 4 months, and that's when you're working alongside of a preceptor. It is not the same person each time. They try, for sure, to make it as consistent as possible, but just with people's schedules and 312s and rotating, it can get a little bit tricky. So you will have kind of a point person for sure, but know that that could be subject to change as well. And you'll also be rotating as well to the night shift for sure. They usually do a couple of weeks of days, a couple of weeks of nights, a couple of weeks of days, so on and so forth, so that your circadian rhythm is not out of whack. Of course, we are concerned, and we certainly review over the schedule with the leadership team as far as what that looks like for sure. Each week of your orientation on the unit, the education team, the leadership team, and your preceptor will literally look over it to determine where you should be week 1, week 2, week 3, up through week 12, 13, just to make sure that things are coming along for you and you're getting all optimal experiences and you're catching on okay and you're doing fine from a medication administration or a documentation perspective or communication with other members of the collaborative team, whether it be PTOT or the different physicians or consultants. So a lot of it is mirroring at first, and then, before you know it, the roles are reversing or switching, and you're taking the lead, and your preceptor's kind of listening and kind of paying attention and there to support you along the way. Each unit will feel very different, of course. ICUs are going to feel different than floors. Floors are going to feel different than EDs. The energy of a unit can certainly be different as well. So it is not uncommon, and perhaps not right now, but as you get closer to your start date here, if you've interviewed and you'd like an opportunity to shadow and you've been offered a position, that's something that can be considered for sure. You'd want to reach out to us and or the leadership team that's hired you, but that has to occur after you've been offered. We otherwise can't really support shadow opportunities until after you've been offered a position. It's just too high volume, and of course right now with COVID, that's discouraged for sure. All of the nurses at our hospital wear seal blue, which is sort of that light blue color. I would say people like FIGS and Grey's Anatomy, it doesn't really matter as long as it's a neutral seal blue color. As we enter into the colder months, you can certainly wear neutral color long sleeve undershirts if you'd like, and then neutral color tennis shoes work great as well. There is the opportunity, if you want, to order scrubs through the hospital. I would say most people don't, but if that's something that you're interested in, on our intranet, you can order shirts and sweatshirts and scrubs and all of that stuff as well, but it's totally optional. And we do expect that you are responsible for purchasing your own scrubs, unless you're in the perioperative service line. And in that case, surgical scrubs are issued to you upon your start date. So far, does anybody have any questions? I know I've been rambling and talking quickly, so I'm happy to have a moment of pause if you have any questions, or I can continue going on and talking about our benefits and answer any questions after that.
So one question just came in just in terms of resumes and what you look for as a recruiter, in terms of putting all of your clinical rotations on there, erring on the side of less is more. So just talking about what you look for in a resume.
Yeah, absolutely. So in a resume, one page is fine enough, particularly for a new to practice nurse. I mean, if you have a past professional life, and you feel like it's sort of corresponds or goes alongside of your nursing career, certainly add that, or if it helps to explain years between graduations or different things that you've done, by all means. We really know sort of what your clinical experiences look like, for sure. Generally speaking, most colleges and universities try to get you through all of the basic clinical rotations and experiences. But if you are particularly interested in a certain area, you could certainly expound upon that a little bit. But again, that's why when we send you a separate RN application query, that's when we really delve into why you want to work in that department and if you have any touch points to it. So your resume is something that really should be able to be sent out to multiple hospitals. I definitely caution you, please look really carefully at your resume before you submit. It is not uncommon, sadly, for us to see to the attention of GW or Georgetown or Maryland Shock Trauma. And we recognize that you guys are interviewing at a lot of different facilities and we want it to feel and be the right match. But again, nurses need attention to detail. And so it is important that for each facility that you apply, if you are customizing it, that you obviously identify the hospital that you're interested in working in, that you're submitting your application to. Obviously, certifications, we're going to see if you're BLS certified or ACLS certified, or if you've been a certified nursing assistant in the past. That certainly helps for sure. Your application is ultimately forwarded along with your resume to the leadership team for review. So again, if there is a particular area like oncology or geriatrics, and you've worked with different caregivers, I mean, anything that really sort of separates you so that you stand out from the rest is all very helpful. But we also know that we have a lot of new to practice graduate nurses that have had very much sort of similar educational paths and experiences.
That is very helpful. Thank you. One additional question came in about references. So can you talk specifically about MedStar Washington Hospital Center and how you deal both with references and what you're looking for, as well as letters of recommendation, and if there's a difference there, if it's the same, and when in the process students would be submitting this information to you?
Yeah. So on the application that you'll submit is when you'll indicate 2 references. And those are the references that if you're offered a position and you've accepted a position, it's already been identified on your application that that's who you want us to reach out to for references, is when we submit our universal background check on your backgrounds. Those will be the 2 references. So very much it should really be from a employer that you've under. If you've never worked, then, well, it's crazy to think that. But yeah, if you've never worked, you'll want to indicate if you've worked in any community or volunteer programs for sure in that vein. So your references on your application are really literally for upon hire, and that's what's reviewed under your universal background. The references or the reference letter or recommendation letter is what we're paying attention to, quite frankly. We're going to see from a nursing instructor or a nursing supervisor or somebody that you've had a clinical rotation with. That's what we really want to see, where you stood out, sort of strengths for sure. Your energy is going to be important, your teamwork, your collaboration. It is required that for all nurses who work here that your GPA is greater than a 3.0. And so that is something that's identified as well. That doesn't have to be a part of your recommendation letter, but really it's just more of the personal side of you as far as the recommendation letter from somebody that you very recently worked with from an academic setting or from a nursing setting.
And when specifically will they be turning in the letters of recommendation?
Yep. So we used to have on-site interviews not too long ago. And during your on-site interview is when you'd want to bring everything that you have, which is usually your BLS card, your letter of recommendation. If you have an unofficial transcript, that's typically when it's submitted. Under these circumstances, what will happen is if you've been offered a position, you accept a position, we will bring you in for pre-employment. And pre-employment is a time that you've received your offer letter. You don't need to sign and scan it. It's just for you to review. When you come in for pre-employment, you'll sign off on the hard document then. You'll go over to occupational health for your physical and review of your immunization record. You'll go down to security for your picture to be taken for your photo badge ID. So when you're coming in for that pre-employment appointment, that's when we want you to have sort of that packet of information. So again, letter of recommendation, transcripts, BLS, ACLS card if you have it. And then of course, from a background perspective, when they run your I-9, you're going to want to bring your passport and 2 identifiers with you. But again, at that point in time, you'll have that touch point, that relationship with your recruiter, and we'll be emailing you back and forth everything that you need to bring closer to. So please don't feel like you need to jot down all the nitty gritty right now. Again, the biggest thing that you can do right now if you want to work at the hospital center is to apply and go through the process. And certainly we'll make sure that all your questions are answered, because I'm sure you have some individual things along the way.
So that is all the questions for now.
Okay. All righty. So I'll talk a little bit about our benefits here. So we have 3 health insurances to choose from here at the hospital center. We have Blue Cross Blue Shield, we have Kaiser, and we have our MedStar insurance. It's totally up to you which one you go for. And, you know, it oftentimes depends on people's deductibles or if they have family. Again, after your interview, we do send off benefits for you to take a look at just so you have an idea of some of the different things that we offer. In addition to health benefits, we have vision, we have dental, we have short-term disability, we have long-term disability. We do have a 403B, which is very similar to a 401k. We're just a nonprofit institution from a retirement savings standpoint. And we do certainly give all of our associates PTO, paid time off. Great. That's the hospital's fire alarm. I'll see if it's applicable or not. So I'll keep talking for a moment. So our PTO is 20 days per year, gradually increases the longer that you're here. And then we have 2 personal days which do not roll over. So your PTO will roll over, your personal holidays will not roll over. And then parking is on campus for all of our clinical staff nurses, which is a wonderful thing. So I always like to sort of asterisk and emoji that one because that's obviously a big deal. That parking is available on campus for all of our clinical staff nurses. Another wonderful thing that I like to mention about the hospital is we do give $10,000 back a year for tuition reimbursement. So a lot of our nurses do take advantage of that after 3 months of employment, which is great because you're usually through sort of the classroom orientation portion of your orientation. But I would also encourage you to give yourself a little bit of time to think about what you may want to go back to graduate school for, get your feet wet a little bit with different clinical areas for sure. But again, a lot of people do take advantage, both local universities, GWU, Georgetown, Maryland, Howard, Trinity, Hopkins, what have you, or online programs as well. And so that is called our Tuition Ed Assist. And you apply for that through our intranet, your leadership team signs off on it, and it's really quite that easy. And that would be for if you're interested in advanced practice, nurse practitioner, education, leadership, informatics, what have you. So again, a lot of our nurses do take advantage of that for sure. I think that's for the most part it. I really like to talk about the PTO. It's great PTO for sure, particularly as a nurse where you're working 312s. You can really sort of carve out your time working on the front end of the week, Sunday, Monday, Tuesday, then taking several days off in a row before the back end of the following week and working that Thursday, Friday, Saturday. And so you'll find that the PTO certainly works in your favor along with creative scheduling on the unit. The schedule is through a platform called Clarevia. After you get off of orientation, you will be able to sign up for your WISH schedule. The schedule is sort of open for all of the staff nurses to indicate what their preferred shifts are, as long as it follows sort of the scheduling guidelines. There's a committee of nurses on the unit that work on the schedule to sort of cross and dot and bless it and make sure that it's fair and equitable. And if it is, certain number of, weekends and off shifts and all that's included, then the nursing director will go ahead and sign off on it. So, you guys are all professionals at this stage of the game, but do know that a lot of shift swaps happen as well. So if you're through orientation and all of a sudden you've got a concert that you want to go to, or a doctor's appointment, or you just need to get home and go out of town for a little bit, then it is not unusual at all to switch shifts with people as well.
Thank you so much.
Yeah, you're absolutely welcome.
Do you still have some time? Fire drill wise, okay.
I'm okay. Yeah,
okay.
The house is not burning. We're good.
Great. So we have two questions that have come in. So the first student asked, they have applied to the program at MedStar Washington Hospital Center and sent in their follow-up email with their preferences. When should they expect to hear back from a recruiter? What does that timeline look like?
Yep. It's usually within about a week's period of time. Right now is a really busy time, so we've just got a lot of applications. So if you have not heard anything in the next couple of days or so, Catherine will have my email address and you can certainly follow up with me. Not a problem at all.
Great. Okay, so the next question is about interviews, specifically now that many of the units are transitioning to virtual interviews. Can you just speak a little bit about what students should anticipate and expect in terms of how long, who they would be meeting with, and any tips you have for the virtual interviews?
Yeah, so the virtual interviews are either via WebEx or Zoom. And it really varies according to the different unit and leadership style. They can be 15 minutes, they can be 30 minutes, they can be longer than that. I would say, generally speaking, you have the opportunity to email with the leader, whether that be the nursing director or one of the patient care managers. And there's oftentimes a staff member that participates as well, just so that they have the opportunity to ask any questions. You have the opportunity to ask a staff nurse any questions. So it's just sort of just optimal to have all pieces of the puzzle together. They're going to generally ask you questions about why you became a nurse, what your favorite sort of clinical rotation was and why, if you are interested in a specialty area or certainly a med-surg area, why do you want to particularly work on that unit? Is going to be really, really important. If you want to start off in the emergency department and there's nowhere else you'd rather be, that's great. But if for whatever reason, there's just not a position available in the emergency department, so you end up, working your first position, let's say on a surgical floor, when you're interviewing with that surgical department, you don't want to talk about the ED. You want to talk about the reason why that would be a great sort of starting off place to be as a new nurse. And I will tell you, I started my residency program here many, 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 many years ago. And there's just wonderful opportunities. And so, whether it's here or any other facility, graduating and passing your boards and getting that RN certificate and license will allow you just so many opportunities and possibilities. So you don't have to, if your desired unit doesn't work out for you, you've got many more years, and you'll certainly gain something from wherever department that you start off in, probably way more than you'll ever expect. I actually encourage folks to consider starting off on the floors. I feel like you really get your nursing fundamentals in, your nursing basics in, that patient priority setting, that delegation, that working with the whole collaborative team, and working in that area for a couple of years and then transferring to a higher level of care at that point in time. One doesn't often sort of step back into that sort of med-surg floor cardiac environment if you're already starting in a higher level of acuity. And there's a lot to be said for starting off on the floors and on the step downs for sure. So I would just caution you to be very patient. Try not to be too sort of impulsive. You know, if this is why you've gone to nursing school for a specific environment, then that's one thing. But if you're sort of flexible and just want some really good fundamental and basic experiences, definitely consider that. You will not be, it will serve you well in the long run. Also, if you are interested in going back for an advanced degree, I will tell you that the advanced practice provider leadership team, they really like to see a number of years of clinical experience in different settings.
Kim, thank you so much. I think you answered all of the students' questions, and the information you provided was wonderful. So we really appreciate it. Best of luck to all the students that have participated today. And Kim, thank you again for your time, and we certainly look forward to staying in touch. Thank you so much.
Yeah, no, it's my pleasure. And best of luck to all of you guys with the end of school year and NCLEX review and all that good stuff. Take care.
Bye-bye. Thank you.
Bye.